Jasmine Reyes.
And I'm Wendy Quintero.
Today we have 4 different segments or social injustices coming right up. Stay tuned in. Every year, new patients and non-patients abuse prescription drugs. Prescription drugs are meant to help people who need medical attention, not for people to use for recreational uses. Wendy Quintero is here to talk to us about how prescription drug abuse has increased due to easy access from doctors and pharmacists, the lack of parent awareness, and the misuse of prescribed drugs. Wendy, what can be done to fix this injustice?
Thank you, Jasmine. Prescription drug abuse is increasing yearly, but the problem is preventable. The government has a plan they are implementing. The plan came into effect in 2010. Implementing Obama's 4-step prevention plan, educate, monitor, proper disposal, enforcement will help reduce prescription drug abuse. According to Substance and Mental Health Service Administration, SAMHSA, before the plan was created between the year of 2002 and 2009, prescription drug abuse increased by 20%. Implementing the 4-step prevention plan will help reduce prescription drug abuse. I interviewed a doctor from Healthcare's Partner who wished not to be recorded, but here is what she had to say.
I think this prescription drug abuse epidemic is a problem that many people aren't aware of. But like you said, implementing Obama's 4-step prevention plan I think will most definitely help reduce prescription drug abuse, and people are going to get educated and going to be more aware.
By implementing Obama's 4 prevention plan, fewer people will abuse prescription drugs and it will reduce the percentage.
That sounds interesting, but our own Hannah doesn't agree with you. Let's see what she has to say. Hannah? We're ready for our close-up. Wendy, you are on the right track, but let's take a look at the bigger picture. Implementing the 4 steps prevention plan might be helpful, but where are the funds for the plan going to come from? Providing the education, monitor system, disposable programs, and laws are going to require a good amount of money. According to SAMHSA, the plan will ask for an additional $132 million for drug prevention, an additional $99 million for treatment programs in the years 2012 and 2013. Although the plan could work, there is absolutely no way our country is able to afford and support the plan. At the end, prescription drug abuse is a problem that will increase with or without a prevention plan.
Hannah, I understand what you're saying about the funding, but that $123 million and $99 million needed will be an investment for the future. SHMSA stated implementing the plan will save the lives of millions. By implementing the plan, it will help reduce prescription drug abuse by educating, monitoring the drugs, having proper disposal programs, and enforcing laws to stop prescribing practices. Implementing and investing in the prevention plan, it will not only help reduce prescription drug abuse, but save the lives of millions who have been abusing prescription drugs. All this talking about a 4-step prevention plan, I want to break up a citizen solution. Education is the key to everything. It's the start. Citizens need to get together and create a community group where the goal of the group is to bring awareness about the dangers of prescription drug abuse. I conducted a survey at Loyola Marymount University where the majority of the people agreed prevention groups would help reduce prescription drug abuse. Here is what a student had to say when I asked him if he would join a prevention group in his community to help reduce prescription drug abuse.
Yes, I think prescription drug abuse is a problem many people are unaware about. If people got more involved in prevention groups and got educated people more aware, then it would help reduce prescription drug abuse in communities.
By providing prevention groups, it will bring awareness to both the community and reduce the lack of parent awareness and help reduce prescription drug abuse.
Thank you, Wendy. Hannah, what do you want to do about this? Well, take a look at the graph you brought up. You say you conducted a survey at LMU asking them if creating prevention groups in their community would help reduce prescription drug abuse. You are doing cherry picking because you only showed the college students and didn't survey any parents. Even though that students agreed that prevention groups would help reduce prescription drug abuse, how many of those students would actually join the group? People who are abusing prescription drugs do not want to come out and say, I abuse prescription drugs. Therefore, they don't want to be told what the dangers are of prescription drugs are, and telling them so will most likely drive them to abuse more.
Hannah, you are right about the survey. I did only survey college students, but I also asked if they were an only child and if they would join the prevention group. More than 80% said they were not an only child, and more than 60% said they would join the prevention groups. Next time, I will make sure to survey a variety of people, including parents. However, a student I spoke to agreed bringing awareness to the people in the community about prescription drug abuse would not only better the understanding of the problem and would join the next group. Not everyone is going to join as soon as people heard there's a new group. We have to educate the community about the problem so they can choose between ignoring the problem or starting to do something about it. I think creating prevention groups will increase awareness to people who are in danger of abusing prescription drugs and to those who are actually abusing prescription drugs. Reporting from Fin News, I'm Monica Dale. Back to the studio.
Wow, Wendy, I can't believe everything you just told us about prescription drugs. I know what I'm doing when I get home. I am going to rearrange my medicine cabinet. When we come back from this short commercial, we have an interesting story with Jasmine Reyes about what can be done with people who have autism.
Jasmine,
Yes.
will you be my Valentine?
What is that?
I made you a trail list.
Thanks.
I got you a Valentine grab too. You can get it next week in front of the office.
In the past 20 years, autism cases have increased by over 60%. Autism spectrum disorder affects behavior, communication, and social interaction skills. 1 in every 88 children in the U.S. have been identified as having autism. People with autism are not receiving proper resources due to the lack of parent education, budget cuts in the communities, and improper diagnosis. Now here's Jasmine talking to you about what can be done.
Thank you, Wendy. People with autism need all the help they can get, and there is a way to provide that for them. Every year, someone with autism does not receive that extra help, which would be very beneficial to them. By instituting the Autism Behavioral Analysis Program for children, we can see a dramatic change in these individuals' lives. In a previous court case, a young 2-year-old autistic boy was denied the access to 40 hours of therapy a week without any explanation. His parents fought for over a year for these hours, which would have been crucial if he had not received them. According to an article from Cincinnati, Judge Barrett stated children would suffer irreparable harm if he is not provided appropriate early intervention services. He said those services, at least in Roman's case, should include ABA. It is important that at an early stage of autism, our children are already learning the basics of life. If we sit around and do nothing, we will not see the results we are looking for. Programs such as ABA make sure that individuals work step by step in the areas autism affects. 40 hours a week means a lot. As instructors, they can set a goal for these people and get things done within this amount of time.
That's a great idea, Jasmine. This would provide more jobs for those in the major and help children out. But some people disagree with you. Emma in the studio has also worked in this field and would like to give her opinion. Emma, what do you think? I would totally have to disagree with you about the ABA program you have mentioned. 40 hours a week for people with autism is a lot of time. Oh my God. But have you thought exactly where the money's going to come from? In my latest research, I surveyed students at Loyola Marymount University, asking them if the government should invest money in special education, and most students were neutral about it. It takes millions of dollars to provide for individuals with autism or any special need, let alone pay for programs that would cost a lot for every single person. It can cost about $32 million to take care of an autistic person over his and her lifetime. Caring for all the people with autism over their lifetimes costs an estimated of $35 billion per year. Oh my God. If we invest our money, we will all end up being in more debt than we already are. The economy needs to be fixed first before investing in little things like this. I am these individuals to improve the skills the lack of is due to the autism, but there's a certain point where we have to be realistic and think of the cost. If 1 in every 88 children develop autism, that would be 1,000 children times 35 billion every year. Oh my God.
And I disagree with what you just stated. We don't always need the money to come from the government. A little donation from places here and there can mean a lot. Autism Speaks, the world's leading autism science and advocacy organizations, today announced the award of $48 million in funding 14 new projects. To date, Autism Speaks has committed more than $195 million for research projects that advance understanding of the cause, prevention, treatment, and cure for autism spectrum disorder. The Autism Speaks organization did not need the help of the government in order to raise this much money for individuals. With the help of this money, we can guarantee that people with autism will be changing for the better. Thank you for bringing me to my next solution, Emma. The next solution could be the most brilliant idea for both people with autism and mainstream people. Often we aren't aware of how to deal with an individual who is diagnosed with autism, and we don't know the right from wrong, but as a parent we can request for children and teachers to be trained ahead of time before someone with autism enters a mainstream classroom. In my previous solution, I mentioned that I passed around a survey at LMU. In this survey, I also asked if before the school year started, would they find it helpful to be trained ahead of time, the do's and don'ts of autism, in case someone with autism is in their classroom. And out of 32 people surveyed, 15 students would want to be trained, while 14 other students didn't really care if they were to be trained or not. Here's what one teacher had to say from Creative Solutions about being trained ahead of time.
I believe training for students and teachers would be helpful. Instead of making fun of someone or not knowing what to do, we could help that someone. I want people with autism to know they are welcomed even in schools.
Thank you, Jasmine. Emma, what are your thoughts? Once again, it's a great idea that you believe others should be trained ahead of time about autism, but where are we going to get the money from in order to have these training classes? I would like to point out once again in my survey that out of 32 students, 13 people felt neutral about spending money on special education. If the survey shows 13 out of 32 people don't care about the money, then why should we waste the money? We would save ourselves money and fix the economy. Either way, the government is cutting back on the funding on autism and other health services. According to Autism Speaks, medical and social security will not be cut, but autism activities in the National Institute of Health, the Centers for Disease Control and Prevention, and the Health Resources and Services Administration could be cut as much as 9.3%. In order to get what we want, we need to use the money, and in this case, money is also involved. With budget cuts, we are limited a short amount of money. No teacher wants to volunteer giving a lesson on an autism kid.
I would like to take a minute and point out your graph. If we look closely, you are apple polishing your data. In your graph, you spread out the numbers between 12 and 13 to make it look like there is a big difference, but there really isn't. It was up by 1 point. I also would like to point out that money isn't everything. If we are passionate about things, then we would try everything possible to get all the help we can get for these individuals. Here is what a student at Lawndale High School had to say about the solution.
In my opinion, especially because I have seen it in kids that have autism and like mainstream or general ed classrooms, you can see that the teachers, the subs, or the aides are not really trained or familiar with ABA strategies and things like that, but you can see that they try to redirect behavior in a way that they would with a typical child.
For more news, follow me on Twitter at JasmineFitNews. Now back to you in the studio.
That's a very interesting story, Jasmine. I didn't know there's a lot that can be done for people who are diagnosed with autism. Stay tuned for Angela's story about the STEM system after we come back from this Spirit Week commercial.
Buenos días, estudiantes. A partir del 12 de febrero comienza la Semana de Espíritu. Martes es el día de pijama. Miércoles es el día de los deportes. Y el jueves es el día de San Valentín. La camisa tiene que ser rojo, rosada o blanco. Pero recuerden, sus pantalones tienen que ser de uniforme. Y el viernes es la semana de los 1950. Gracias.
U.S. students are becoming less engaged and falling significantly behind the rest of the world in terms of STEM. science, technology, education, and mathematics. Learning compared to other developed countries, American students rank 25th out of 30 in math and 21st out of 30 in science, according to the U.S. Department of Education. Angela Lowell is here today to give us her stance on STEM education. STEM rank lower than in other developed countries. Without a greater emphasis on STEM fields, Americans' job market will fall even further behind. Here's Angela with more information.
Thanks, Jasmine. Minorities in the STEM fields are being underrepresented, but this can be fixed. The government has the power to reinstate affirmative action within colleges, which will directly affect the STEM fields and the access available to minorities. Princeton University defines affirmative action as a policy designed to readdress past discrimination against women and minority groups through measures to improve their economic and educational opportunities. As you can see from my graphs, a survey conducted at Loyola Marymount University, otherwise known as LMU, 93% of the students I interviewed said that they would be in favor for the reinstatement of affirmative action. Affirmative action is important because it helps people not be discriminated against because of their skin color. This creates a colorblind society.
Wow, that's fascinating, Miss Wool, but I don't think everyone sees the topic as you do. Our very own Monica has her views and has been researching this topic.
Thank you, Jasmine. I think that Angela has not thought this out completely. Many people disagree with the reinstatement of affirmative action because it makes more highly qualified people get denied. Many experts say that ability is ability. According to an expert on debate.org, he states, if you can't do the work, you can't do the work. If you can do the work, you can do the work. I'd rather have one who is hired on ability only. Angela's graph demonstrates cherry picking because according to the people she surveyed, she chose minorities. They should count for more. Why should a college admissions choose less qualified people? Therefore, if you want the best of the best, you need to hire the best. Demographics need to count after the ability is present. Sure, demographics make colleges look better, but in STEM, we are looking for the best and brightest students. Monica is right about the survey. Most of the students I interviewed were minorities, but that was only because most of them were coming out of their classes, and I did not have the chance to survey all of the student body. Co-founder of Urban Scholar Athletes, a program to transform the lives of urban youth through academic enrichment, athletic resources, and community service initiatives.
Alexis Coleman states,
Strongly support the reinstatement of affirmative action for colleges and universities. First case in point would be because I believe that there should be an equal representation of all races at every educational level, particularly in post-secondary. Oftentimes, in many colleges and universities, you have certain populations that are not represented, and so because they're not represented, we lack the diversity that we should have.
Ability is ability, but there are minorities that suffer lack of opportunities due to their race. This is why affirmative action will help, and most people can agree. Affirmative action is positive for minorities in the STEM fields because then they have role models to follow. Parents can be role models as well. Many citizens have a misconception on STEM, but I have a solution that might get everyone involved. STEM can easily be accessible to students if citizens expose their children to STEM education at an early age. Early exposure with parent involvement is a great way to get students involved. Intel Corporation revealed that 63% of teens have never considered a field in engineering. Additionally, 44% stated that they would consider engineering as a career if they knew more about it. Because most students don't know what STEM is, they don't formulate an interest. Early exposure can be simple as choosing between what educational shows to watch, video games to play, and books to read. Simple choices make a difference in a child's exposure to STEM. Parent involvement is a major factor in exposing children to STEM. Parents should be interested in their children's future.
Thanks, Angela. Do you have any thoughts on this, Monica?
That's an excellent point, Angela. But how do you really know that parents are willing to get involved with their children? Most parents cannot get involved because they have other jobs and other priorities. They cannot be with their children all the time. Furthermore, if you ask a low-income parent with 2 children, they would not have the time to spend with their children. I'd like to take a look at the statistic you used. 63% of students said that they never considered a STEM career. You are using disestimation here. You are taking this number too literal. You do not know the circumstances they were in. You need to take into consideration that this was a survey conducted to teen children and it was not various age groups of children in America. Sure, the survey could be accurate, but it could have been within a small portion of children. Monica, you are right about one thing. Parents might not have the time, but children are our future. What they decide to learn now can make a difference in their lives. According to Parent Engagement Education Program, it states, significant research studies show that PK increases children's academic success. Parent Alfredo Guerra, involved in PK program, who did not want to be filmed, states,
yes, parents should be more involved because education is something important and it's something every kid should have for them to be able to get a good opportunity when they're grown up.
Parent involvement is effective. Monica, parents' first priority is to help their children achieve in life. Minority students deserve a chance and have the right to achieve their goals, including careers in STEM fields. For Fin News, I'm Angela Luell. Back to you guys in the studio.
Thank you, Angela, for your interesting message. I think it really makes me think about what the future holds for America's STEM jobs. After this short commercial, stay tuned for an interesting segment with Lynn. Do you want to graduate? Herf Jones wants you to graduate. Seniors, make sure you buy your senior package February 8th after school. Don't be late before it's too late.
According to the author of The Element, Ken Robinson, education doesn't need to be reformed. It needs to be transformed. The key to this transformation is not to standardize education, but to personalize it. Standardized tests such as the SAT and the CST have become such a dominant factor in today's education that the true meaning of the quality of education have been withering. Lynn Chan is here today to talk to us about the testing culture and how these tests have negative effects on students because they limit students post-high school education, use class time unproductively, and create disadvantages for low-income students. With all this gloom and doom, Lynn, what can be done to this injustice? Thanks for coming into the studio, Lynn. You mentioned earlier about some solutions.
To alleviate the negative effects, the government can try to model after Finland's education system by requiring teachers to receive more training before they enter the profession. Business Insider states that Finland's teachers teach according to content and assess their students with tests teachers create themselves. If teachers are able to receive more training, they are more experienced and can create better assessments to focus on the learning of the students rather than the behavior of the students. A survey done at Loyola Marymount University showed that over half of the students who took the survey wanted America to model after Finland's education because teachers are held accountable for students' education. Teachers work closely with them to track their progression by working on students' weaknesses and enhancing their strengths.
Thank you, Lynn, but the president of the Centinela School District opposes.
It's a pleasure to be here. Lynn makes some very good points, but she has left out very important information. America is not able to model after Finland's education system because it's not certain that more years in school will mean better teachers. For instance, Teach for America teachers teach fresh out of college, and some of them have turned around the low-income schools they work in and have taught the kids with the knowledge they've been deprived from. Why should they have to go through more years of school when they're already equipped for their jobs? Lynn's graph demonstrates this estimation because it only shows a small percentage of the student body. Therefore, it does not represent the whole student body and their thoughts.
Thank you, Mr. Councilman, but after looking into Finland's education system, I believe that more years in school does create better assessments and learning environments for students. Let's listen to what expert Harvard grad Milo Lam from Game Desk has to say.
I believe Finland's rigorous training programs and requirement to get a master's degree allows their education to seem like the epitome of perfection.
Clearly, in Finland, more training experience has led to better teachers for a better learning education, and although this may not be the case for every individual teacher, on average, Finland seems to be the model of education everyone wants to emulate. Additionally, the survey I conducted at LMU may not reach the whole student body, but I was able to reach the students who did go through the American education system, which is a perfect demonstration. The government's action may take some time due to the long process, but citizens are able to take immediate actions. Citizens can choose to opt out of STAR testing. Parents and students can easily take charge every year so students don't have to stress over standardized tests. Nearly 80% of the students at LMU who took the survey didn't know they could opt out of CST testing. LMU student says, parents can easily take action and help their kids stay away from the negative effects of standardized tests. Therefore, choosing to take action doesn't require a lot of work. It just takes the parent to tell a school official they don't want their kids to take the STAR test.
Thank you, Lynn, but the president of the Centinela School District opposes.
Although parents can opt their kids out of STAR testing, districts will consequently suffer. School districts are heavily dependent on students' performance on these tests. According to the education perspective, schools receive funding from the government based on test performances, and if students choose to opt out of standardized tests, schools are at risk to lose funding and may consequently be shut down. Lynn's graph demonstrates cherry picking because she only chose students in California. It's unsure whether students from other states know they can opt out of testing. Choosing to opt out of STAR testing may only hurt both school and school district. Therefore, lack of efficient funding may place students behind since they're not able to receive proper supplies for a learning environment.
Thank you for coming in today, but some school staff members have been organizing clubs to support parents to opt out of testing while working with districts to maintain funding. Additionally, students from any state can choose to opt out of state testing. According to Education Perspective, schools in California only need 95% of test scores to receive funding. However, one school in La Guentes School District in Marin County, California, had less than 95% participation and was successful at boycotting the test while remaining their usual federal funding. I'm Lynn Tran, and now we have Jasmine and Wendy back to the studio.
Well, that was very interesting, Lynn. I can't believe what you just told us about standardized testing.
Thank you for tuning in to Fin News. We hope you have enjoyed our stories.
Thanks for tuning in.